problem.
What is your stance on Medicare for all and healthcare?
I'm for universal healthcare.
Oh, you are? Okay.
Yeah, I think we'd have to have some kind of like basic coverage for universal standard, meaning like if you're having an episode, this is particularly where we bring you in, we help you. If you're broken bones, flu, things that it's like relatively simple and knowledge based. The challenge with it is that we got limited space, we got limited doctors, but I don't think we can function as a society if we have people just dying in the streets like we do with drug abuse and
Well, then you should promote housing first policies.
Okay.
So the first bunch of that was kind of arguing about stuff that Tim had said in the past or things that Sam and Emma had said about him. And, a lot of that, like, I think, look, a lot of that, I think that like Tim was being a little disingenuous about, like, like, I think it's pretty obvious that like the whole thing with Sam was that like, Sam took, do you want to come on my show as, encompassing the possibility of coming on through Zoom. And, and that's like a pretty straightforward, like, I think Tim's being a little bit disingenuous about that, but like, but putting that aside, it's like a lot of that is like kind of, a lot of that early stuff is not really that interesting to me because it's like sort of, there's an element of like he said, she said about like what somebody said in the past. We're not watching it right now. And that's not really what I'm most interested in hearing from these people about. Last part was really interesting. I want to pause here to give you a chance to weigh in on this because I really liked this moment from Emma where she took the sort of the subway crime claim and to talking about Medicare for all and mental health. And that, and I particularly want to give you a chance to comment on this because Tim's position here seems to be like Medicare for all, but only for emergency care, not preventive.
Right, as in like what we already have. That's called EMTALA. That's been the law of the land since the 1980s, and you can't deny someone emergent care. Whether medical emergencies, obstetric emergencies, you cannot deny. So we kind of already all have that. But the flaw with this argument, I guess, what he would call universal health care is the sort of the safety net of being able to get medical care when you have an emergency, so people aren't dying in the streets, and that's all well and good. But if that's all you're doing, and then when it comes time for maintenance and health prevention, disease prevention, primary care, sort of follow-up secondary care for management of chronic illnesses, and that's not covered, you're going to have such an overwhelming amount of people with medical emergencies, and the declining in I guess the decompensation of chronic conditions, where that's a top-heavy medical system that's going to cost more money. Like an ounce of prevention is worth 1,000 pounds of treatment. So if you're not going to cover someone's ability to see their doctor every few months, to have their blood pressure medicines refilled, have everything checked out, labs done, all the routine health maintenance, and people can't get that done if they can't afford it out of pocket. But you let that guy walk around for, a decade with uncontrolled blood pressure, cholesterol, sugar, whatever else, and he ends up needing a quadruple bypass and to go on, dialysis, and then that's covered. That's quite literally the most expensive, least cost-effective, and unfeasible way you can run a medical system. And effectively, it's what we already have. So I'm not really sure where he was going with that.
Yeah, I suppose it's possible that he just means that, I guess the difference between what we already have and what he's floating is that, like, you'd be that you wouldn't get the bill when you got back from the hospital for your emergency.
Okay.
That's charitable. Right. I think he's being really unclear about what he means. But even if that is what he means, which would be an improvement of the status quo, like, it's also, I think, crazy for exactly the reason you just said, right? It's like, well, hold on. Like, people who can't afford, because people don't, like, just in the normal course of life, people don't go to the doctor to get stuff checked out all the time because maybe they don't have insurance. Maybe they do have insurance and they don't, but like it's still
they have a copay.
Yeah, exactly. Right. So it's like you have something that like, could be cancer and could be nothing, that like, you just hope it's nothing and keep plugging. And it's like, yeah, that just seems like if you're like just having the state cover a bunch of emergency medicine, but not preventative medicine, that's like even just like in totally take the morality out of it, just in terms of like cost efficient use of resources like that. Like that's crazy just on those grounds.
Yeah. And of course, like bringing in the social determinants of health, because that actually ends up having a much larger impact on health outcomes than health policy does. And so bringing around, I think at some point, I don't remember if she already did it as far as what we were watching, but I think at some point she starts talking about things like universal housing and other sort of socially driven programs to help people from ending up in desperate situations, and asking him his position on that. I think that was another good sort of rhetorical tactic to kind of challenge his viewpoint. I'm curious what you think about the debate about crime. I think if I'm calling balls and strikes, I think that discussion was a little bit of a wash, because violent crime, I would probably contend a little bit that violent crime is necessarily correlated directly with poverty, as opposed to crime of either like property crimes, theft, crimes of disorder, and things like that. I think certainly you make a strong evidentiary argument based on what we've seen historically that those things are tied to poverty, but I'm not sure that you could make a clear-cut argument that violent crime correlates with poverty. As far as what I've read, I'm not an expert in this area, but I also think that at some point the actual Justice Warrior guy tries to use the fact that crime dropped after the Great Depression as a way to like debunk the notion that poverty and crime were related, which I thought was pretty silly, and it's been addressed pretty thoroughly in writing historically. So I think this is a good example where you have one person debating two people who are both sort of dropping pseudo facts and statistics, but she's doing a good job of bringing it back around to what she knows and to what's really relevant here.
Yeah, exactly. I mean, I think on the crime discussion, so the actual Justice Warrior, Sean, who I should say, I've debated or been on panels, debating him a couple of times at different events, and including on this topic. And I think there's part of what he's saying that's plausible, like that, like I think is true, but I think the more important part I don't think is. So, like, in other words, okay, I do think that it's a mistake for the left to be sort of too quick to be dismissive of concerns about like spikes in crime and sort of say like, oh, that's all fear mongering, whatever. Like, I think like working class people are rationally worried about public safety. There's tons of polling, on that. I don't think that, I don't think we should adopt like the solutions of the right, on that. But I do think we should take the problem seriously. And I think one of the best points I ever saw about this was from an article a couple of years ago by Eric Levitz, New York Magazine, where he said, look, if, we thought it was a big deal on the left when like a lot of people at least temporarily lost their health insurance, during the economic disruptions because of COVID, we wouldn't say, well, okay, but whatever, it's not a big deal because, there's still fewer uninsured people than there were before Obamacare, right? Like that's, we have to make that argument, right? So I think it's a mistake to sort of say, well, increases in crime aren't that big a deal because, and I'm not necessarily saying this is what Emma meant or whatever, because, because it used to be much higher in the 90s. I think, I think that, again, I do think we should take the concern seriously. But I also just think crime does have a lot to do with poverty. And I think I get what you're saying, but I think maybe within violent crime, it's useful to make like a finer distinction. So like what kind of violent crimes are we talking about? Because obviously there are definitely kinds of interpersonal violence that have nothing to do with economics. I would never deny that. Like a lot of, like domestic abuse,
murders, and
like crimes of passion, like that. There are things like this that, that again, I don't think you could reduce to economics, and and I'm not very optimistic that these things would ever go away completely, even in a totally different and much better economic system. But I do think that the kinds of violent crime that like really drive like the crime rate, like gang violence, things like that, do seem to have everything to do with economics. I mean, just intuitively, like there seem to conspicuously be no cases of, kids who grew up in like affluent families in the suburbs and joined street gangs. That doesn't seem to happen. And, it does seem like maybe non-coincidentally, Nordic countries that have, really powerful labor unions and really strong welfare states and, have, they're still capitalist countries, but have achieved like a much higher level of, certain kinds of economic equality than we do, like, have much more lenient and humane criminal justice systems, but still less crime, right? Like still a lot less crime. And like, I mean, the sort of standard joke we always used to make about this on the show, we bring up this point is like, come on, like if you think that this is just that their like culture is innately nicer, watch that movie from last year, The Northman, right? That's
right.
I think that there are. I don't think the culture is just innately nicer. I think that part is economics. You have been watching free public content from Give Them an Argument. To access every single episode of the show, the main show on Monday nights, all of the streams, all of the debate breakdowns, all of the patron-exclusive postgames on Monday nights, all of the patron-exclusive bonus episodes every week, and much, much more, go to patreon.com/Ben Burgis. I cannot resist ending this with, don't be foolish.